I was pretty shocked when the doctor told me that I had diabetes. Everything that I always known about diabetes is something that's very, very inconvenient and having to take injections. It's something that I don't feel that I'm ready for it yet. And I don't know how I'm going to deal with it.
Nowadays they say there's a global epidemic of bird flu. That's a minute number when you compare it to the real global epidemic of type 2 diabetes. When I tell my patient you have diabetes, he doesn't think about the early stroke or the early heart attack or the 15-year shorter lifespan that he might suffer from. The first thing he thinks about is insulin, and will I have to inject all my life?
The technology was based on many years of study in Hadassah, in Jerusalem Hospital. We worked for almost 30 years on oral insulin.
Oramed developed a technology which actually facilitates the entrance of insulin through the gut, meaning that you can actually take the insulin, put it into a pill, swallow it, and some of this insulin will go into the bloodstream. Having an oral insulin pill would probably make it easier for us to treat type 2 diabetes and make the lives of the patients easier, to make their quality of life better. Of course, the main obstacle for initiating insulin therapy to the patient is the injections. They're all very afraid of the injections. If we would have a pill of insulin, we would probably give it quite early in the treatment. And we're now starting to promote insulin's role and maybe start it in an earlier phase of treatment because it has a lot of advantages.
This technology will enable diabetics to stay more balanced, and it will keep their pancreas functioning for a longer period.
Another advantage is that it's more physiologic. When we secrete insulin, we secrete it from the pancreas, it goes straight to the liver where it works initially by telling the liver not to produce more sugar. If you deliver insulin through the gut, it will mimic the same route as the endogenous insulin.
And by doing so, not only that we'll be able to have, the believe, a better quality of life, but the entire society will benefit from lower cost of the disease and from a better life and for a brighter future thanks to Oramed.